Good afternoon, everyone. I'm just going to give folks a minute or so to join the webinar, and then we'll get started. So good afternoon and welcome. Today's webinar is called When Cutting Costs Costs Health, What You Need to Know About Federal Policy Changes. My name is Becca Bolas, and I am the Executive Director of Maine Public Health Association, and I also serve as the Chair of the American Public Health Association's Action Board, and I will be your moderator for today's discussion. We are so happy that you're here and really want to thank you for taking time out of your very busy schedules to join us for today's webinar. Next slide, please, Dawn. Thank you. I have a few housekeeping items I just want to go over before we get started. The first is for you to know that today's webinar is being recorded and there is closed captioning service available. If you click on the CC at the bottom of your Zoom player, you should be able to access that feature. And we will do our best to take audience questions throughout today's presentation and at the end. And if you sent your questions in advance, our speakers today have tried to incorporate answers to some of those questions in their presentations. If you do have a question today, you can type it into the Q&A box, which is located at the bottom of your screen. And you can add questions as they come to you, and then we'll try to take them throughout the presentation, but most likely at the end. Next slide, please. So just for some framing for today's webinar, in June and July of this year, the U.S. Congress passed two large bills that really formally upend decades of public health work in the U.S. and abroad. To pay for tax cuts, Congress changed eligibility criteria for Medicaid and for SNAP, the Supplemental Nutrition Assistance Program, and codified funding cuts for global health and democracy programs, as well as public broadcasting, among several other provisions. And we know that programs like these actually save money. They lead to greater worker productivity and better qualities of life. As just one example of that, research suggests that for every SNAP dollar invested in children, $62 in value are saved over the long term. So when the government cuts expenditures by cutting public health programs, it actually puts us at greater risk of increased costs to the economy and to our health. It can be confusing to follow all of these policy and funding changes, which were very large and happened very fast, and what they mean for you, your work, and your community. So during today's webinar, our speakers will review some of the major provisions in these spending bills, including the implementation timelines, and identify paths forward, including advocacy, education, and outreach. So with that, let's get started. Today, I'm joined by 5 panelists. Our first panelist today is Dottie Rosenbaum, who is the Director of Federal SNAP at the Center on Budget and Policy Priorities. And Dottie will give us a general overview of what's been going on and a bit of a deeper dive into SNAP policy. Our second panelist today is Allie Gardner, who is Senior Policy Analyst also at the Center on Budget and Policy Priorities, and she will be reviewing the Medicaid changes. Our third panelist is Nicole Repfogel, Senior Policy Analyst at the CBPP as well, and she'll be reviewing changes to the ACA marketplace. Our fourth panelist is Liz Scott, who is the Director of Federal Clean Air Advocacy at the American Lung Association, and she'll be reviewing changes that impact clean air and energy policies. And our last panelist today is Don Hoppert, who is the Director of Government Relations at the American Public Health Association, and he'll be covering advocacy opportunities as well as fiscal year 26. So with that, I will turn it over to Dottie to get us started on today's panel. Thank you, Dottie.
Great. Thank you so much. And thank you so much for inviting me and my 2 colleagues from the Center on Budget and Policy Priorities to present today. We're sort of lucky and uniquely situated that we have health and SNAP and housing and a whole bunch of other things under the same umbrella at the Center on Budget and Policy Priorities. So we're very happy to do this and look forward to actually learning more about the health side, since I don't know that so much. I'm going to start with just a little bit. You can go ahead and advance the slides, please, Don. A little bit on sort of, one more, sorry. I'm going to cover the high level bill as a whole and then dig a little bit deeper into SNAP. But I wanted to start with what this process was, right? This was the Republicans using reconciliation, which you may have heard of, in order to enact a series of tax changes and program changes with only Republican votes. And it's different. I mean, I just want to give a little bit of budget background on sort of how this fits into the overall federal budget process when you hear about different pieces. Sometimes the budget is talked about as one thing, but it's really made up of a whole bunch of different laws and processes. So there's two kinds of federal spending. There's mandatory spending, which means that the program's authorization, what describes the program, and the funding are in the same law. And most big benefit programs are mandatory spending: Medicaid, Medicare, the ACA subsidies, SNAP, Social Security, most benefit programs. The spending is often, but not always, based on program rules that make certain people eligible for certain benefits. And those programs usually continue without additional action from Congress. The other type of federal spending is discretionary spending. This is spending where the authorizing law describes the details of the program, how grants are awarded, or who might be eligible for funding from that program. But the funding comes from a separate appropriations law. And many programs other than the benefit programs in the health and human resources area fall under this category, including funding for the National Institutes of Health, the Centers for Disease Control, SAMHSA. WIC is discretionary. Many other programs where it's a grant program that goes to states and then gets passed through to schools or other grantees are discretionary. Discretionary spending is as I said, the funding is in appropriations bills. Those have to be enacted every year. It's usually 1 year of money that's made available. And when we've heard about rescissions in the last few weeks, that's when the Congress takes away money that they appropriated in the past. So the stories about rescissions are related to discretionary programs. Reconciliation, the process that was used that we're talking about today, is only used for mandatory programs and revenues. It's a special process that expedites consideration of spending and tax legislation. It's special in large part because in the Senate, the filibuster does not apply and debate is limited. So it only requires 50 votes in the Senate. And that is how it was able to pass with only Republican votes, because it didn't need the usual 60 votes that are needed to break a filibuster. Even for a reconciliation process, this was a very fast process. It had a lot less debate than sometimes happens with other reconciliation processes, which go on for more like a year or two. It did not get a ton of news coverage. It got some, but there was little bit of other stuff going on in the meantime, and so there was less news coverage than normal. So that's just a little bit of context for what it is we're talking about today. We're talking about the changes that were in reconciliation. You can advance to the next slide. So I included this slide just for sort of how we're talking about the bill as a whole. I thought that was maybe helpful context. We're basically saying these deeply harmful Republican changes will take healthcare and help affording the high cost of food away from millions of people to partly pay for trillions of dollars in tax cuts that are skewed to the wealthy. You can see from this slide, there's 15 million people who will have their health coverage taken away and be uninsured. Raises costs for 20 million in the ACA marketplace, on and on and on. The SNAP, it could end SNAP as a national program by forcing unaffordable costs onto states, and all of this for $4.8 billion in tax cuts that are skewed to the wealthy. And it will make the debt and the deficit worse. In the next slide, we show at a high level, this is showing the total cuts over the budget window in SNAP and Medicaid and ACA marketplaces compared to the cost of the plan's tax cuts for just households with over $500,000 of income. They're basically the same size, right? So it's really intended to show just how skewed this bill was in terms of the distributional impacts. Okay, now I'm going to switch to SNAP, which I know a little bit better and I'm a little bit more comfortable with. So next slide, please. So who gets SNAP? Who gets help from SNAP? SNAP provides about $6 a day on average in benefits for people to buy food just like everybody else does at grocery stores, at supermarkets, through normal food retailers. About 90% of the people who are helped by SNAP are in families with children or elderly or disabled. Next slide, please. So the big picture is that the cuts to SNAP in the bill, in the harmful mega bill, are the largest cuts to food assistance in US history. It's a 20% cut to SNAP, or about $187 billion over the budget window. One of the questions that was sent in advance is, where do we see the biggest threats? I would say the biggest threat that we see is the cost shift to states. The bill basically cuts federal funding for SNAP benefits by 5 to 15% for most states, which may not sound like a lot, but in the context of state budgets, it's a huge amount. And we can share some materials that we pulled together where we sort of show, compared to the budget of other things within the state, how much this cost shift would be. So it's forcing these unaffordable costs onto states for the very first time. SNAP benefits have always been 100% funded by the federal government. Some states could seek to cut SNAP deeply or drop out of SNAP, which would basically be the first time that SNAP is not ensuring a consistent benefit for children, older adults, and others who live in different states and who have, that people have the same access to food assistance. It expands SNAP's work requirements very significantly. It cuts off refugees, people granted asylum, and others who have been admitted for humanitarian reasons from SNAP benefits, from food assistance. It cuts SNAP state admin costs in half. Currently, the federal government covers half of states' administrative costs for operating SNAP, and that will drop to 25%. It completely eliminates SNAP's nutrition education program, known as SNAP-Ed, starting in just a couple of months. And it cuts future SNAP benefits by preventing SNAP from keeping pace with the cost of a healthy diet for things that change in the cost of a healthy diet other than inflation. So next slide, please. Just to give you a sense of who will be affected by these benefit cuts, every single one of the more than 40 million people who receive food assistance through SNAP will be affected by the cut I just mentioned, which is a cut to future benefits. About 4 million people will have their food assistance taken away or cut substantially, according to the Congressional Budget Office, including more than 1 million children from the other changes in the bill. I think it's important to point out that the cuts to SNAP and child nutrition benefits, which I'll talk about in a minute, how there is child nutrition potentially cuts in this bill, could be larger than CBO's estimates if more states deeply cut or terminate SNAP in response to this reduction in federal funding. So it's a really, really big unknown in this bill. And the risk of such cuts will rise during recessions when state budgets are even more stretched, because states have to balance their budget every year. So when a recession hits and need goes up, the resources are even less likely to be there for states to fill that hole. Next slide, please. So I have a little bit more detail here. I'm probably not going to have time to go through all of the details that I have here. I've included too many words. But I think that the most important thing about this cost of shift to state is that it's a major structural change. It ends the historical national commitment since the hunger in America of the 1960s and 70s to guarantee benefits to eligible households regardless of where they live. The state share is based on state payment error rates, which measure administrative mistakes that are made in the program by state officials and or households not reporting the right information. It's very rarely fraud. It's almost always honest mistakes made by, as I said, by the state or by households. And you can see here, I'm going to show you in a couple of slides in case you're interested of where your state stands now. But the cost share doesn't go into effect until 2028, so October of 2027. But the share is based on the state's error rate for 25 and 26. So that's now, right? That's the error rate in fiscal 25, which is what we're in right now, and 26 is what starts in October. So states are already scrambling to figure out what they're going to do to lower their error rates. Next slide, please. There are really no good options for states to replace these lost federal funds from the cost shift. They're either going to have to increase taxes, cut spending elsewhere in their budgets, cut SNAP, which really they can only do, we think, by restricting eligibility or erecting barriers to make it harder for people to enroll, or they can opt out of the program altogether, terminating food assistance entirely in the state. There's also some competing factors that, since they're going to have to pay a higher share of administrative costs starting in fiscal year 27, that's going to make it even harder for them to succeed at trying to lower their error rates to reduce their state costs. And so it's increasingly, or there's a real risk that the kinds of things that states will do to reduce their error rates to lower their state match will limit access and make it harder for folks to access SNAP. It's already quite difficult because of SNAP's error rate system. There's already a lot of paperwork required, a need to frequently recertify benefits. And so there's a risk that that will get even worse. And any children who lose SNAP as a result of the cost shift will also lose automatic eligibility for free school meals and summer EBT. So that's an extra challenge for folks. The next slide is the one I mentioned, where if you're interested in where your state stands today in terms of their error rate and the state match they would face if this policy were in place now, you can look here. We would expect that these error rates would have come down anyway because they were somewhat elevated due to changes that were made during the pandemic and after, and sort of the unwinding focus on Medicaid over SNAP. But I just wanted you to have this, and we'll do a pretty map for next time. Okay, so that's the state matched. Quickly, I want to flag a couple more of the provisions. This one has a lot of words, but SNAP already has a rule, a work requirement that says that if you are non-elderly, non-disabled, and don't have children in your home, you can only get SNAP for 3 months if you're not working at least 20 hours a week or qualify for a limited set of exemptions or live in an area where the state has applied for a waiver based on high unemployment. So this bill law significantly expands that SNAP harsh, ineffective, red tape laden work requirement to include, and some of this is aligned with Medicaid, adults where the youngest children in the household is 14 or older, people who are 55 to 64, certain groups of people who recently became exempt under the Fiscal Responsibility Act will no longer be exempt. The veterans, people experiencing homelessness, and people recently aged out of foster care. And then it also severely restricts these area waivers for places where there's insufficient jobs and high unemployment. I'll show you a slide on that in a minute. So we estimate that more than 5 million people, about 1 in 8 SNAP participants, will live in households that will be at risk because of this. And you can see a lot of households with children, people with older adults, and lots, 1.1 million in areas with insufficient jobs. CBO estimates that 2 million people will lose eligibility altogether. And all of this, despite the fact that SNAP's work requirements have been in place for a very long time, and the research evidence shows that they do little to nothing to improve employment, but instead result in many, many people who are already working or who should be exempt losing food assistance due to the red tape. Next slide, please. Again, this is just so you can see which areas are affected by this drop in the ability of states to waive the time limit. The orange areas on the one with more orange areas are states that have broad waivers right now. And on the right, you can see that almost no areas will qualify for in the future. Next slide, please. This is about the immigrant restrictions, which have been described as keeping illegal immigrants from accessing SNAP, but in fact, the people who will be cut from SNAP are people who were admitted based on the U.S. government determining that they had a humanitarian need for assistance. Refugees, people who have been granted asylum, other victims of sex trafficking or domestic violence, and so forth. And then my last slide is just to make a point about the timing of all of this. Some cuts are going to go into effect very quickly. The work requirements and the immigrant restrictions, there is no specified implementation date. We're waiting for guidance, but they're effective on enactment basically because it was silent. So we really need to, the law was silent on how states should phase it in. So we're waiting to hear about that, but I expect those will go into effect soon and will be one of the first places where we're really seeing harm from this bill. And then, as I mentioned, the SNAP Ed cuts go into effect very soon. The cost shift, as I also mentioned, goes into effect in 28, but the error rates are right now. So I'll stop there, and I think I'm turning it over to Allie for Medicaid, right? Yep. Thanks.
Yes. And I wish I had better news on the Medicaid side than the SNAP side, but it is a similarly bleak story. So we can go to the next slide. This law includes over a dozen of Medicaid related provisions, which total to more than $900 billion and cuts to the program over a 10-year period. CBO has estimated the law would result in approximately 10 million people becoming uninsured, with Medicaid coverage losses accounting for the majority of this. These coverage losses will be concentrated largely among Medicaid expansion enrollees and will be driven in large part by mandatory work requirements, more frequent redeterminations of eligibility, and immigrant funding restrictions similar to what Dottie just described on the SNAP side. These coverage loss estimates, though, don't account for individuals who are duly eligible and with Medicaid and other insurance whose coverage may become unaffordable without Medicaid. Nor do the estimates account for individuals who maintain Medicaid or any other insurance for that matter, but lose access to providers or services due to the impacts of the law on providers' ability to maintain current services or keep their doors open altogether. And while the estimated effects of the bill or the law reflect CBO's best estimates of how states may respond to these policy changes, the actual consequences could be better or worse depending on how state actions. If states implement more restrictive policies to coverage or care, especially if under budgetary pressures, then the impacts could be even greater. On the flip side, states do have a little bit of flexibility to mitigate harms of the new policies they're now required to implement, and can reduce those coverage losses. But this will require stakeholder engagement, funding to implement policies, system updates, and making thoughtful decisions throughout the implementation process. For stakeholders who are engaged with their state, this is a key opportunity over the next few years to engage to help influence the direction of policies. Next slide, please. So this just briefly shows the policies that are driving the biggest cuts to healthcare, and Nicole will go over some of the marketplace side of things that are described here in just a minute. But for Medicaid, mandatory work requirements for expansion enrollees, restrictions on provider taxes, which are a way states finance their state share of the Medicaid program, and other red tape policies are really driving those over $900 billion in cuts. Next slide, please. So there are too many Medicaid provisions in this law to go over everyone in depth in 10 minutes, but I'm going to highlight some of the key provisions that will result in the greatest harm to both enrollees and have the greatest impact to state budgets where states may be forced to make tough decisions to make cuts to the program. A couple things to know. These provisions, similar to on the SNAP side, all go into effect at different times. Some are already in effect as of the date of enactment, while others are delayed until after the midterms or even later. And secondly, a number of the provisions only apply to Medicaid expansion enrollees or have disparate treatment of expansion states compared to non-expansion states. So that's where on the right side of the chart, it indicates what states these provisions apply to. The provisions that have already gone into effect as of the date of enactment will largely not have an immediate impact felt by enrollees, or in most cases for states, for several years. The exception to this is the 1-year ban on Medicaid funding to Planned Parenthood or other abortion-related providers. While there has been ongoing litigation that has temporarily blocked this provision from going into effect, we've already heard of Planned Parenthood centers contacting Medicaid enrollees saying they no longer accept their insurance, or Planned Parenthood centers that are already planning on closing. There is a prohibition on new provider taxes or increases to existing provider taxes. Like I mentioned, that's a way states tax certain healthcare providers to help finance their state share of their Medicaid program. And that may come into play sooner than originally thought, depending on economic conditions and how states use provider taxes to fund Medicaid. For states that use provider taxes to fund their Medicaid program pretty broadly, states will are now immediately restricted from in their ability to respond to rising healthcare costs. So think of expensive new therapies or treatments or prescription drugs, or to economic downturns where we see Medicaid enrollment tend to go up in response, which results in increased state costs. The provision also makes a technical change to certain provider taxes that will prohibit certain provider taxes immediately and will cause 7 states, which are California, Illinois, Massachusetts, Michigan, New York, Ohio, and West Virginia. Don't worry, I will put that in the chat afterwards. You don't have to remember that. But those states will immediately have to start a plan to get rid of those provider taxes, and they will not be able, because of the other prohibition, to implement new provider taxes to fill that revenue hole. And similarly, the new limits on state-directed payments, or what we call SDPs, set limits on SDP rates to Medicare rates in expansion states and 110% of Medicare rates in non-expansion states. And that affects one option states have to reimburse providers, since Medicaid typically has low reimbursement rates. Next, the Rural Health Fund. This was a flashpoint in the final weeks of the reconciliation discussion and has been a focus given the quick timeline states and CMS have to distribute the $50 billion in available funds of this Rural Health Fund. States must apply for and CMS must approve all applications. It's a one-shot deal for allocations by December 31st, 2025. CMS has indicated as of today that applications will be coming in sometime in September. Half of that funding, or $25 billion, will be split evenly across all states that are approved, have their application approved, while the second half will be distributed at the discretion of the secretary under some pretty broad parameters. And the law does include specific things that fund can be used for, including technology investments and reimbursing providers for services. But over the past week, Administrator Oz has been encouraging states to use the funding they receive for tech improvements, telehealth, or workforce training without a lot of highlighting using that for reimbursing providers. The next wave of provisions will go into effect October 1st, 2026, and these are immigrant-related changes. So first, states will no longer receive federal match for covering most immigrant populations, including lawfully present individuals. This is similar to the changes that Dottie mentioned earlier on the SNAP side of things. This does not change Medicaid or CHIP eligibility for these individuals, but it is likely to result in states ending coverage for the populations, especially given the immense budgetary pressure they're going to be under. Additionally, the law reduces federal matching rates expansion states currently receive for providing emergency services to individuals who would otherwise be eligible for expansion if not for their immigration status. This does not eliminate the obligation to treat people under EMTALA, but it will reduce the amount that states get for providing those services. Next slide, please. And I promise to be as quick as possible. Sorry, there's a lot here. Now, onto the provisions that will have the most direct impacts to coverage and care of Medicaid enrollees. And frankly, these are some of the most discussed provisions, all of which will go into effect after the midterms or later. So enrollees in all states will see a reduced retroactive coverage period that will either be reduced to 30 days for Medicaid expansion enrollees or 60 days for all other Medicaid populations. Happy to provide some resources on retroactive coverage after this. Then part of the provider tax provision is a phase down of the allowable tax rate, which is currently set at 6%. Only expansion states will have to phase down most of their provider taxes from current levels down to 3.5% beginning October 2027. So this will exacerbate the state budgetary impacts, not just of provider taxes, but kind of the crunch and state budgetary pressures states feel. Then on to the biggest cut to Medicaid, and arguably the most publicly discussed one, which is mandatory work requirements for adults only in the expansion population. This provision would also apply to Georgia and Wisconsin or other states that begin providing coverage to any subset of expansion adults. The law does include some exemptions, but kind of they're very limited, and exemptions are not a perfect fit or perfect solution to people not losing health coverage. While states are required to implement these provisions by January 1st, 2027, they do have an option to seek a good faith waiver for 2 years if they are trying to come into compliance. They can also seek implementation earlier through a state plan or 1115 waiver. And I promise, time check, I'm almost done. States must also begin at the same time redetermining eligibility for expansion enrollees twice a year instead of once a year. And we've actually heard from states they are most concerned about the implementation of this provision, given the massive systems lift this is going to be. There is more on SDPs that I'm happy to discuss afterwards. But for the purposes of this conversation, finally in October 2028, expansion states will be required to begin imposing cost sharing for certain services on expansion enrollees with incomes over the poverty level. Those cost sharing amounts have to be some above $0, but up to $35 per item or service. And states will now be permitted to allow providers to deny services if an individual is not able to pay. Currently, providers cannot deny services even if the state does require cost sharing. I think that's it. So I'm going to pass it on to Nicole. Thank you guys for bearing with my speed read.
Thank you, Allie. And my name is Nicole Rapfogel. Thank you all for tuning in today. So we'll pivot to ACA marketplace policy. This is going to be a really high level summary of some very technical changes. So I encourage you to reach out by email if you're interested in some of those more technical aspects. Next slide, please. So some background on marketplace coverage. When we talk about the ACA marketplace, we're talking about individual market coverage. So coverage for people who don't have employer-sponsored insurance, Medicaid, Medicare, in its most basic sense. Marketplace enrollment has reached all-time highs in the last few years, and in 2025, there were 24.2 million people enrolled in the marketplace. This increase in coverage is in large part due to enhanced premium tax credits. Next slide, please. So in the Affordable Care Act, they included advanced premium tax credits that enable people with low and moderate incomes to receive tax credits that make their premiums for their marketplace coverage more affordable. The American Rescue Plan Act of 2021, and then later extended in the Inflation Reduction Act of 2022, enhanced these premium tax credits to be more generous and to apply to more people. In the harmful Republican mega bill, PL 11921, we've been discussing, Congress failed to extend these enhanced premium tax credits. They had the opportunity and they did not. And so without additional congressional action, these enhanced premium tax credits are set to expire at the end of the year. In that case, we expect 4.2 million people to become uninsured over the next 10 years and see very steep premium increases. Those with incomes above 400% of the federal poverty level would not receive tax credits at all. And we expect those premiums to about double. Those with 200 to 300% of the federal poverty level, we expect those to double. And then those with 150 to 200% of the federal poverty level, those premiums we expect to increase fivefold. And then with under 150% of the federal poverty level, they would go from $0 coverage to about $400 per person. So these are really huge premium changes. They'll be inaccessible for many people. I'll share a resource after this. We've talked to a lot of marketplace enrollees who have discussed just how impossible it will be to maintain their coverage under this, and I can share that resource after the chat, in the chat after this. Next slide, please. So this is a little different than the other policy areas we've been discussing because there are two tracks of policy changes. First is the mega bill we've all been discussing, and then 2 weeks prior to that passage, there was CMS finalized the Marketplace Program Integrity and Affordability Final Rule that made additional changes. So starting with the mega bill, the provisions in the bill take effect in 2026, 2027, and 2028. As I've mentioned, it fails to extend enhanced premium tax credits. It also makes significant changes to premium tax credit eligibility, particularly for immigrants. So all non-citizens except legal permanent residents or green card holders, specific people who migrated from Cuba under a very specific family reunification program, and COFA migrants would lose access to premium tax credits altogether. It adds new red tape barriers that make it more difficult for people to get and retain ACA marketplace coverage. And it removes protections that prevent people who estimate their income to be different than what it ultimately is when they file their taxes. They have to pay back that amount when they file their taxes. And because a lot of marketplace enrollees are gig workers, temporary workers, tip workers, lower income people who might have volatile incomes, if they don't estimate their income exactly right, they owe back this money. And there were previously limitations so that they don't owe like an insurmountable amount of money, but those have gone away, so they could end up with a huge bill come tax time. The Marketplace Program Integrity Final Rule also has provisions that take effect in 2026 and 2027, but some of the provisions start to take effect 21 days from now, August 25th of this year. Some of the provisions in the rule sunset at the end of 2026. And so there's kind of some, when calculating the savings associated with the mega bill, by sunsetting some of these provisions, they were able to kind of reclaim some of those savings as part of the savings associated with the mega bill. And so some of these provisions will end at the end of 2026, and they could be extended by administratively or legislatively, but we don't know. So there's a lot of confusion around that. And, it's big changes that are possibly temporary. And then many of the provisions also last, indefinitely. And I can provide resources that get into more detail on that. Some of the key changes in the final rule, shortening the open enrollment period and ending a special enrollment period for people with low incomes to enroll in coverage year-round if they don't have any. In addition to the immigration changes in the mega bill, the final rule eliminates marketplace eligibility altogether, so not just premium tax credits, but enrollment in the marketplace for DACA recipients. Like the mega bill, it adds red tape barriers that make it more difficult to enroll and stay enrolled in some different ways. And it also makes changes that enable plans to be less generous and limits consumer protections. Next slide, please. So a lot of these have to do with administrative barriers. And while, needing to provide additional documentation can sound innocuous, what happens when there are layers of red tape is people who are eligible for these premium tax credits or other benefits won't enroll because it's too difficult and burdensome to meet all of these kind of hurdles that they need to enroll. And so documentation can be difficult to obtain, and uploading or mailing it in can be cumbersome and complicated. So when things are complicated, people with high healthcare needs are more likely to submit the paperwork and jump through those hoops because they know they need coverage. People without immediate healthcare needs may decide it isn't worth the effort and they won't enroll or re-enroll, right? And we know people who don't have healthcare needs right now, they might tomorrow, right? Something, their needs change, something catastrophic could happen, and without that coverage, they may not be able to get the care they need. But also in the marketplace, when fewer people without immediate healthcare needs enroll, while more people with healthcare needs enroll, the case mix becomes riskier, and so issuers raise premiums for everyone. Next slide, please. So, big picture here, all of these, whether they're in the regulation or the law, they add up. So things like higher premiums, higher out-of-pocket costs for people who remain covered, red tape, as you mentioned, the shorter enrollment, open enrollment period, and the end of the low-income special enrollment period, no repayment limit on advanced premium tax credits, and eligibility cuts all result in fewer people covered. When they are covered, it's at a higher cost. As I mentioned, this weaker risk pool results in higher gross premiums. In addition, the administration has cut federal funding for the Navigator program by 90%. And navigators are enrollment assisters. They're people who help enrollees navigate all of these changes, submit their documentation, and actually get the coverage that they need. And without funding, there's going to be much fewer people available. And so the combination of not having people who can help while making all of these really complex changes is going to be particularly harmful. Next slide, please. So big picture here. First, marketplace enrollees aren't in a vacuum from the other provisions we've been talking about. As I mentioned, it's people with volatile incomes, with lower incomes, and they're people who sometimes need Medicaid or CHIP, sometimes need SNAP, and kind of go through all these programs at various points in time. So these all add up for people who are currently enrolled in Medicaid, currently enrolled in Marketplace, might lose coverage, all of this. We're talking about essentially the same group of people. And it's important to know, right, that everyone can have changes like that suddenly make them, in need in a way they weren't before. These policies make it harder for people to get and stay covered. As we mentioned, fewer people covered means higher costs for everyone in the marketplace. Without coverage or with coverage that is not affordable to use when you do have it due to higher out-of-pocket costs, people can't get the care they need. That means less use of preventive care. That means people who have conditions that could have benefited from early intervention won't be able to get that, and then their health issues become more complicated and more expensive at a later date. And as I'm sure I don't need to tell this audience, right, all of this is intersecting with social determinants and drivers of health. Health coverage is not the end-all be-all on determining health. And it also, when costs go up, when people can't access this care, when things are stressful, it's impacting how people live, play, work, individuals and communities, with some serious ripple effects. Thank you. I think Liz is up next.
Hi, I'm Liz Scott. I'm the Director of Federal Clean Air Advocacy for the Lung Association, and I'm sorry to pile on more bad, but I'm going to talk about the changes to clean air programs that were in the law as well, since that also carries health consequences. Next slide. So first, we're going to take a walk back to 2022 and look at the Inflation Reduction Act, since that was really the roadmap for what the majority wanted to cut and target. This was the largest investment in climate change mitigation in history. And so what did that include? It included tax credits to make more efficient vehicles like electric vehicles and charging infrastructure, as well as the production of renewable energy sources like wind and solar. It provided consumer tax credits to help people actually buy the electric vehicles and the more efficient vehicles, as well as to do energy efficiency upgrades. So like purchase a heat pump for their home. It included billions in grant funding for climate pollution reduction through a couple of different programs. And that included grant funding, for example, to reduce pollution from ports, which are some of the dirtiest places in the country, and from heavy duty vehicles like school buses. Farmers and other rural businesses could get funding to purchase more efficient equipment to run their farms and save money. There was funding to monitor and reduce air pollution. It included a program to hold oil and gas companies accountable for reducing methane emissions, which of course accelerates climate change. This is not an exhaustive list of what was in IRA, but these are, again, what provided the roadmap for what this reconciliation process targeted. So next slide. So the biggest chunk of attacks on clean air through this reconciliation law came through the tax code. So all of the tax credits that I mentioned on the previous slide already had an expiration date, but this law accelerated them. So they basically pushed them up. So the consumer tax credits to help people purchase more efficient vehicles, like electric vehicles and hybrids, they expire September 30th. Initially, I think it was 2032. So they really accelerated the phase out of those consumer tax credits. Additionally, the consumer tax credits to make energy efficiency upgrades on your home will expire at the end of the year. Starting on January 1st, there will be restrictions on some of the clean energy manufacturing credits. So the manufacturing of cleaner renewable energy sources like wind and solar. At the end of June next year, the tax credits for some of the EV charging installation and energy efficiency credits for builders will expire. And then the credits for wind and solar energy completely terminate at the end of 2027. So in addition to the tax credits, they really went after unspent money of the Inflation Reduction Act. And so this included rescinding funds from programs like a grant program to reduce air pollution in schools, grant funding to do additional air monitoring, the Clean Heavy Duty program, which included a lot of funding to help dirty diesel buses, for example, transition to electric buses. That included some school buses. The ports program and climate pollution reduction grants. There is also the Greenhouse Gas Reduction Fund, and I have a star next to this because in addition to rescinding unspent funds of the Greenhouse Gas Reduction Fund, they also just repealed the program itself. There was a 10-year delay on the implementation of the methane fee. So this is the program that was holding oil and gas companies accountable for their methane leaks. This next one, the corporate average fuel economy, is an important one in the context of current rollback. So EPA is currently rolling back standards for vehicles. The bill eliminated penalties for something called corporate average fuel economy or CAFE standards. These are standards that basically determine like the miles per gallon that a car manufacturer has to provide in their vehicles. So essentially saving you money at the pump if you drive a gas-powered vehicle. The enforcement mechanism of these standards is civil penalties on the manufacturers. This law zeroed out those civil penalties. So there is no teeth to enforcing the fuel economy standards anymore. It expands fossil fuel use. It opens up public lands for drilling and expedites the permitting process. So essentially, if an oil and gas company wants to expedite their permitting, so basically get a faster environmental review, they can pay a fee and they will be granted that faster permitting process. That's a lot of bad news. I'm sorry. Let me try to find a little bit of good in here, or lemonade, if you can go to the next slide. So there were some things that were included in earlier versions that were knocked out in the final. This either because they went afoul of the rules of reconciliation or because there was so much pushback that they had to take it out. First, there was initially a fee levied on EV drivers. So a charge that people who drive an electric vehicle or a hybrid that was intended to take the place of a gas tax, but the math was wildly off. It was way more than what people would pay in a gas tax. So that was taken out from the final version. There was also in earlier versions of the bill an excise tax on wind and solar. So basically a punitive tax that would have made wind and solar companies pay more to create their wind and solar energy. That got a lot of pushback, so it was taken out. I mentioned the Greenhouse Gas Reduction Fund not only had its funding rescinded, but the program itself was repealed. The House version of this bill intended to do that repeal for other programs as well. So for example, the Air Pollution in Schools grant program, they initially wanted to rescind and repeal the program. that was taken out. So while the funding is still rescinded, at least the program and the statutory authority is still there. The House version also included a provision that would have repealed EPA regulations on light duty vehicles. So basically saying the EPA can't issue standards on cars that make them more efficient and less polluting. That ran afoul of the rules of reconciliation. So that was taken out. And then while there is still, as I mentioned, that sort of pay to expedite permitting process, that piece is still in there. But what was taken out was there initially was a limit on judicial review of permitted projects. So not only could, for example, an oil and gas company pay to expedite permitting, they would also severely limit the ability of communities to challenge that permit. So that judicial review piece was taken out of the final bill. So these omissions don't make up for the truckload of bad that was in there. But we had to take the wins that we can. Next slide, and I'll do this last one quickly. So right now, people are really focused on accountability. There was a lot of grandstanding before this bill passed from members of the GOP caucus that said we need to protect these clean energy tax credits. And then, of course, they turned around and voted to gut the clean energy tax credits. There was a political analysis that came out last week that $565 billion worth of investments and over 600,000 clean energy jobs are at risk because of this law. The vast, vast, vast majority of that is in Republican districts. So a lot of groups are focused on accountability, sort of using the cost of living framing to talk about this, since that's what's resonating with members. We mentioned state level work on how states can continue to provide programs to reduce air and climate pollution, but as others have mentioned, state budgets are going to be really tight with what they need to cover. So really what I'd say on what we can do now is the messaging and advocacy. We know there's no shortage of attacks on clean air regulations, for example, that are coming through EPA. And so the more unified that the health community can be in pushing back against this, to be the voice of reason and science in the room, that's really what we, at a minimum, can do now. I will stop there, but I look forward to questions.
Great, thank you, Liz. So this is Don Hopper with the American Public Health Association. I'm just going to talk a little bit. I don't have slides for this, but I just wanted to kind of end the conversation by alerting folks to kind of the third process related to the budget that we are currently in the midst of. So we talked about the reconciliation bill and all of the negative things that were included there related to SNAP, Medicaid, the ACA, and other provisions. We talked briefly about the rescissions package, which is that $9 billion bill that Congress recently passed and the president signed that would claw back previously appropriated money that Congress had approved. Most of that money was related to foreign assistance and the Corporation for Public Broadcasting. And unfortunately, that bill did pass as well. But it only passed after there was definitely a bit of a dust up over a $400 million provision in there that would have repealed some important global health funding related to HIV prevention. So that's a small silver lining that, as similar to what Liz mentioned, some of these bad bills are at least slightly less bad than they could have been as they were initially envisioned. And so the third piece of this is the fiscal year 2026 appropriations process. That is the discretionary spending, which differs from mandatory spending like Medicaid and SNAP, which are dealt with through authorizations and or reconciliation when they want to make changes to those programs. So each year, Congress has to pass 12 annual spending bills to keep the federal government agencies functioning. Primarily at APHA, we focus on the Centers for Disease Control and Prevention and the Health Resources and Services Administration. But there are also other important federal agencies like the National Institutes for Health, the Substance Abuse and Mental Health Services Administration, and many others that provide grants primarily to states and local health departments to undertake a lot of the prevention activities in the states related to chronic disease, substance abuse, infectious disease prevention, public health emergency preparedness, injury prevention and control. The list goes on and on. And just last week, the Senate Appropriations Committee approved its fiscal year 2026 Labor, Health and Human Services and Education Appropriations Bill. And that bill is the bill that primarily funds most federal public health agencies. So CDC, NIH, HRSA, SAMHSA, some of the ones that I mentioned earlier. On top of the congressional activity that is currently underway, the president also submitted his concept of a fiscal year 2026 appropriations bill to Congress, which contained massive cuts to CDC, NIH, eliminated HRSA, eliminated SAMHSA, and contained a lot of other really awful provisions when you think of federal public health spending. Now, the Senate bill that I mentioned that did pass the Appropriations Committee more or less ignored the president's budget request to Congress. CDC received a very small reduction in funding. NIH received a very small increase in funding, but more or less most programs were held roughly at level funding levels as compared to current year funding. The House has not yet taken up its version of the bill. They are tentatively scheduled to do that in early September. The outlook in the House is not as positive as what we ended up with in the Senate. Although it's kind of a stretch to even say the Senate bill was positive. It was, it did less harm than they could have done, and certainly much less harm than the president was proposing. But we do expect the House bill to be less generous to federal public health agencies. So it's really critical that public health advocates who can weigh in with their members of Congress to, as this process unfolds, to talk about the importance of federal dollars in supporting state and local and community-based activities that keep the nation healthy. APHA does have action alerts up on our website right now where you can send a message to your members of Congress encouraging them to adequately fund these federal agencies as they go through this process. So I would ask and really hope that all of the advocates that are joining the webinar today can do that. And obviously there are other opportunities for you. Congress is in recess right now, so there may be opportunities for you to attend town halls back in your states and talk about the importance of public health funding, and also highlight a lot of the negative impacts of the other bills that we talked about earlier in the webinar. Members still need to hear from their constituents that they're not happy with the direction Congress is taking when it comes to healthcare, public health, nutrition, environmental protection, clean energy, the list goes on and on. But unless they hear it from their constituents, they're going to keep moving forward with potentially with other damaging legislation. So I did just want to flag that as well. So again, just a call to action from all the attendees today to really weigh in with your decision makers and well beyond the federal government. You can talk about these issues with your state and local officials as well, because many of these programs are going to trickle down and have significant impacts at all levels of government. And with that, I will turn it back over to Becca for our Q&A session.
Thank you, Don. We only have a couple minutes left, and so before I facilitate a little bit more Q&A, I first want to thank all of our panelists for their time today and for joining us on this webinar, and I really want to thank all of the attendees who are here as well. And thank you to our panelists for answering many questions throughout today's webinar. Do any of the panelists have anything that they want to add before we go to answering maybe one or two questions? Just want to check. Okay. So when you think about prioritizing, and it's really hard, what are some of the highest areas of concern, and what are some potential strategies for remediation within your kind of different domains that you talked about today? I know that that's really hard because you really did cover a really wide swath of areas that we need to be paying attention to. But if you had to kind of pinpoint within your domains highest areas of concern and potential strategies, what comes to mind for you? Allie, you want to go?
Yeah, I can jump in quickly. I think, Medicaid was discussed in a way I've never seen before in my time working on the policy or the program. And I think part of the concern is the effective dates of some of the worst provisions are delayed. So the harm that people feel, as well as the state preparation as states are dealing with other things, specifically the SNAP cuts and the marketplace changes that are more immediate. The worry is both people aren't going to understand the impact, or it's going to be pushed down the line, but also these changes are going to require a lot of work, and states need to focus in other areas too. So trying to do the balancing act is something I'm concerned about. But with that, I think there's real opportunity for stakeholder communities to start educating people now about the changes coming. If anybody lived through the Medicaid unwinding, the biggest success to come out of that was the partnerships that stakeholders had with state agencies and the use of community groups to educate the public and engage people who enrollees in Medicaid like they'd never done before. So I think there's one takeaway. It's being part of the process early, getting the state to work on systems updates early, and making sure enrollees understand and are educated about what's to come and how to maintain coverage.
That's really helpful, Allie. Thank you. I know we're at time. Is there anyone else that want to add anything for your sections?
The only other thing I'll say is that, all of these things are interconnected. So you're taking people's health insurance away at the same time you're cutting funding for public health. And so, people are going to show up in emergency rooms sicker. They're not going to have health insurance, and it's going to really just, somebody's going to show up with asthma. Maybe they wouldn't have had an asthma attack if some of these, clean air provisions were able to be funded near states and ports. And so it is making the connection between all of these haphazard and really dangerous changes with your policymakers and helping them understand the negative impacts on the health of your communities is really critical.
Wonderful. Thank you. I do want to be respectful of time, so we're going to wrap up now, but I did see a request for a potential future webinar on other areas of impact from these federal policy changes. So please stay tuned. Again, thank you so much to our panelists, and thank you to all of you, our attendees, for joining us today. I will be following up with the recording, with slides, and with additional resources, so please keep an eye out for that. And thank you all so much again. Have a great afternoon.